Okay, so hello everyone. Today we will discuss the very important topic of general anatomy, and that is joints. So please mark it as super duper important because this topic you cannot afford to skip before you prepare for your exams. So this is the most important topic, and this topic will remain important for your entrance exam as well. Okay, for your theory, viva, even for your MCQs. You will see a lot of MCQs which will be formed from the same topic. Okay, so that makes us very interesting. Okay, and if we talk about this joints, so you will see there are so many joints in the body, right? We have lot of different types also, so you can see so many joints are there in the body, okay, between the different bones, and we will understand the categorization, the classification before we dive in deeper. Okay, so let us, as we see for all the topics, let us see the competencies which are there in this topic. So that is to describe the various joints with their subtypes and examples, and this is very important. I will try to make it very interesting and understandable so that you remember the examples for a very long time. So please remember, the main thing which they keep on testing is regarding examples and the description of the typing, like the saddle joint, suppose ball and socket joint comes under which category of joint. So we will understand and pay attention to that joint categorization very well. Okay, then concept of nerve supply of joints and the Hilton's law. Sometimes remotely you can see in your MCQ exams as well as in your theory, you can find a short note on this topic, Hilton's law. Okay, so this is topic for short note. Okay, so please remember. And here please pay attention for a second. I have actually made a list of certain words which are very confusing in your examinations and which are oftenly asked and tested in your exams as well. So the first word is syndesmosis, then synchondrosis, symphysis, synarthrosis, shindialysis, and synostosis. It seems to be a tongue twister, right? So by this 6 names which seem to be very close to each other, they are actually very different, and the categorization into which they fall, that is also very different. And so please remember, you will keep on getting confused between these 6. So please mark my word for it, and we will come back to all these words eventually when we will discuss. Okay, so let's dive in. First, that is the part introduction. Okay, so if we talk about the joints per se, the joint is an articulation of 2 or more bones or cartilages that permit the movement. Okay, so the joints, the word joint has been derived from the Greek word. You can write the joint. This word is derived from arthron. Please pay attention, these words are very important for a deeper understanding about this topic. Okay, arthron is a Greek word from where it has been derived. Okay, and the terms which we have taken for our understanding are these few topics, which are the arthrology, then synarthrosis, okay, then arthritis. Okay, all these are the derived terms from this Greek word itself. Okay, just hold on. Right, then the next word which we use for the joint from the Latin, that is articulatio. Okay, articulatio. Okay, this is Latin. All right, so the derived term from this Latin word is articulation. Okay, we will be using these terms eventually. Okay, articulation, means something is joining something. Okay, so articulatio, articulation. So we have a couple of words here which are linked to this terminology. I hope it is understandable. Then we come on to the classification of the joints. Talking about the classification. And from here point onwards, this topic becomes super duper important. You cannot afford to miss to remember this topic from any angle. Okay, so let us see. The joints overall are classified on two bases. Okay, so I'm using separate slides so that you remember. Okay, the first category is the structural classification. Structural classification, and the second category is the functional classification. Okay, so first understand this thing very clearly, that right now whatever we are talking about the very much broad categorization of the classification of the joints. Okay, so number one, first category is the structural classification. So based on the structure, the type of the connecting tissue and the presence of joint cavity, the joints can be further divided into types and their subtypes. Okay, so talking about the first one, that is the structure classification. This further has three categories inside it. Okay, 1, 2 and 3. So we will use these terms A, B and C. Okay, so there are three categories in the structural classification. Now see this image. Okay, so now we are talking about the first category, that is the structure classification. That was 1 Roman numeral. Okay, in this we have the three categories, that is the fibrous joint, cartilaginous joint and synovial joint. Okay, so these are the three categories in the structural classification. I hope it is very crystal clear, right? So don't confuse and be very clear on this. Okay, now based on the types of the connecting tissue and the presence or absence of the joint cavity, we can divide this into these three categories. Now I am first talking about this first one, that is the fibrous joint. Okay, so 1A category mein fibrous joint, I am highlighting this. Okay, fibrous joint. So this fibrous joint further has three types, 1, 2 and 3. Okay, so that is the sutures, second is syndesmosis. You remember syndesmosis, we will talk about them, don't worry. Then gomphosis. Okay, so this is 1A category which we have talked about this. Okay, 1A. Then we talk about the next, that is the cartilaginous joint. Then again we are on 1 only, but this time I am talking about B. So this is the cartilaginous B. Okay, maybe I can remove this so that you are more clear. Okay, 1A. I'm moving in the same manner so that you can revise later on. Okay, 1 second. This is a misprint. I'm just erasing it from here. Okay. So talking about this 1B category, that is the cartilaginous joint, it can be further classified into two categories, that is the primary cartilaginous joints and the secondary cartilaginous joints. Okay, the primary cartilaginous joint is also known as syndesmosis. All right, so now you can guess those syndesmosis, syndesmosis, the words are coming into picture now. Symphysis, we will talk about them in a while in detail, don't worry. Okay, I'm just introducing you into which category these are falling into. Okay, So secondary, that is symphysis. Okay. Then we talk about the 1 C category. C category is synovial. Okay, I hope I am crystal clear on this. One second. Okay, so you can see this synovial joint. So this is category number C. Okay. Now synovial joint has a lot of classification, that is 1, 2, 3, 4, 5, 6 and 7. Okay. So synovial joint has further 6 categories. One is the plain synovial. Okay, I am not writing that. Plain synovial. Then we have the hinge joint. All these are synovial. Okay, hinge joint, pivot joint, then condylar, ellipsoid, okay, then saddle joint, and then ball and socket variety. Okay, so I hope by now largely you know the categorization, and now you can see the difference. Fibrous joint, where you can see the fibrous connective tissue is between the bones. All right, simple. Then you have the cartilaginous joint, where you have the cartilage between the two bones. Simple. Outside it is covered by the fibrous connective tissue, that is another thing, but still the thing between the bones is the cartilage, that is why it was cartilaginous. Very simple. Third category is what is happening. The fibrous capsule is there. There is an articular cartilage, but what is there? There is a synovial fluid with the joint cavity between the joints. Oh, sorry, between the two bones. So that is the reason it is known as synovial joint. So this three differences are there in the joints between the different types. Okay, I hope it is clear to you. Okay. All right. Then we come on to the next. So we have done 1A, 1B, 1C. Now we are looking at the functional classification. Okay. So I am now going to write the second point, that is point number 2, Roman numeral 2. I hope we know what we are looking at. That is a function. Now this functional classification is based on the mobility. Okay, it is based on the mobility. The previous one, if you remember the classification, that was a structural classification, that was based on the type of, this is based on the type of on the type of connecting tissue and the presence or absence of, based on the type of connecting tissue and the presence of joint cavity. Okay, so that was it. And now we're talking about the functional classification, which is based on the mobility. Okay, based on the mobility, the joints can be classified into 3 categories. Okay, so this is 1, 2 and 3. Okay, so what are these 3 categories? Number 1 is the immovable joints. Immovable joints. Okay, then you have the slightly movable, joints. Okay, then freely movable, joints. See, Now understand this, we are not talking about saddle joint, ball and socket, we are not worrying about that. We are discussing the functional classification which is based on the mobility. Okay, so please remember, this immovable joint is also known as synarthrosis. Synarthrosis. These are the terms which are given in MCQs and asked in viva. Then you have the amphiarthrosis. This was the recent NEET question. Amphiarthrosis. Okay, this was a recent NEET MCQ. This was asked in the previous year question papers. Then freely movable are known as diarthrosis. This was given in the same question as an option. Okay, so you can remember this name, diarthrosis. Okay, now please remember the examples. The immovable joint, that is classical example is cranial sutures. Example, cranial sutures, all those sutures in the skull bone. Then classical example for amphi, that is pubic symphysis. Pubic symphysis. Okay, then you have the freely movable joints. So classical examples are all the categories of synovial joints. Okay, all the category of synovial joints. So now, having understood the types and their gross understanding about what these categories are falling into, now we begin with the first one, that is the fibrous joints. Okay, now fibrous joint, if you know, the articulating bones are united by the fibrous connective tissue, right? And these are also the examples of immovable joints or synarthrosis. Okay, immovable joints or synarthrosis. So we can write very easily regarding the fibrous joints. Now I am not writing those numbers and everything, I hope now you know. So I am just now freely discussing about the different joints, okay, from here this point onwards, so that you understand better. In fibrous joints, the articulating bones are united by the fibrous connective tissue. Bones united by the fibrous connective tissue. Okay, what are the features of this type? Features are immovable joints. So these are immovable joints. These are immovable joints. Okay, and it does not have a joint cavity. Does not have a joint cavity. Okay, so features, immovable joint. Okay, this is an immovable joint and does not have a joint cavity. And what is the main important feature of such joints is that they provide stability. They provide stability and also help in protection. Okay, so you can see a classical example of the sutures which are there in the skull. Okay, we will discuss that in the head and neck region. Okay, now talking about the classification of the fibrous joint, I hope you are already aware that is the sutures, syndesmosis and gomphosis. We have already discussed that fibrous joint into three types. Now the topmost category, that is sutures. Okay, the cranial sutures. Okay, now please pay attention. Number one, this category's first point is plain suture. Okay, now sutures, what are sutures basically? First, if I talk about sutures, so these sutures are the bones are getting connected by a thin layer of fibrous connective tissue, or I can say sutural ligament. So because this suture word has been derived by the Latin term sutura, that is Latin, and this means a stitch. Okay, so sutura, Latin means stitch. Okay, so sutural ligament, and they are present only in the skull bones. Okay, and it permits slight movement during childbirth and in children. Okay, and it ossifies, so you can write these are present only in the skull bones plus permit slight movement, and that movement is during childbirth. During childbirth and in children. Okay, and it ossifies with advancing age. Okay, so these are certain points to remember regarding general features for the sutures. Okay, now if I talk to you about the different types of sutures, so depending upon the shape of the articulating surface, the margins, which you can see very differently, so these sutures can be classified into number one, that is the plain suture. So you can see what is happening. The plain suture, see, you need to remember the name of the types, whatever we will discuss from now on, which is the name and the examples. Okay, so that is what is expected out of you to remember. So plain suture is plain and smooth articular margins. As you can see, it is having plain and smooth articular margins. So classical example, median palatine suture, the joint between the palatine process of the two maxilla. We will discuss that eventually when we will discuss the normas. Okay, so you will come to know about this. The second category is the serrate suture. Now reciprocally you can see it is serrated, and you can say the bones are locking articular surfaces in a jigsaw fashion. Okay, so that is reciprocally serrated, okay, and locking articular surfaces in a jigsaw fashion. Okay, in a jigsaw fashion. Okay, so classical example is sagittal suture of the skull. Okay, the midline sagittal suture of the skull. Then you have the number third category, that is a squamous suture, overlapping. So you can see this point is showing the overlapping of the bones. Okay, so classical example, suture between the parietal and the squamous part of the temporal bone. Okay, so you have to remember these examples. So name plus examples are important. ठीक है, so number 3 हो गया. Number 4 is denticulate. So you can see what is happening in this denticulate, interlocking margins of the suture. Okay, this is interlocking margins of the bone, interlocking margins of the bone. Okay, just like a teeth, like teeth of saw. Okay, so classical example, lambdoid suture, and please remember this is the most important one. It has inbuilt, there are bones inside it, has sutural bones. This is the only cranial suture, the most common one, which has the sutural bones inside it. These are also known as Wormian bones. Okay, these are asked in the exams because most of the skulls which you will find in the department, those will have the sutural bones embedded inside it. So the examiner can ask you very easily, so you just have to tell that it is the lambdoid suture in which you see maximally the sutural bones or the Wormian bones. Okay, so it has some if there are big sutural bones, then it has some importance, clinical importance when we talk about the diameters of the skull. Okay, so during neurosurgery also, so that becomes very important, and these are easily visible on a CT scan, so that can be found out if you're planning any surgery in this region. Okay, then we talk about number 5. Number 5 is shin dialysis. I hope you remember shin dialysis, the 6 terms, the one of these terms again. So this is a classical example, joint between the rostrum of the sphenoid bone and the upper margin of the vomer bone. Okay, so this is the classical example of shin dialysis. So what is happening, if you see very carefully, the ridge of one bone fits into the groove of the other. Ridge of one bone fits into the groove of other. Okay, so you can see this seems to be a ridge and this is a groove, so the ridge is getting fixed, so a ridge is getting fixed into the groove. Okay, so suppose this is a groove, so ridge is getting fixed into the groove. Okay, simple. So this is the classical and one and only example, that is shin dialysis. So we know by now shin dialysis. Then we talk about the clinical or clinical integration of this topic. Clinical integration is a very important. Clinical integration, applied anatomy. If you don't write this or study about this, anatomy is not going to help you in the first year, and you will be suffering a lot if you don't study the clinical side by side. Okay, so if you stay with me, see all my classes, you will find clinical anatomy very interesting, and anatomy will become very interesting. And I personally love anatomy because it is a foundational science for all the clinical branches. So you cannot skip to learn anatomy, because even if you do MD specialization in any branch or MS general surgery or any kind of radiology or any surgery, so you have to come back to anatomy. You cannot do anything as a doctor if you don't know the anatomy. If you are seeing a patient in the OPD, the pain is there in the abdomen, so you should be knowing exactly which region of the abdomen and which organ may be involved, so that on that basis only you can make a diagnosis. So anatomy becomes very essential for any doctor who is practicing or teaching for every aspect. So the term here is synostosis. Synostosis. Ortho becomes very easy if you have studied all this. Okay, now synostosis in the elderly, the sutures, they undergo obliteration, or I can say fusion, and this union is called as synostosis. So see the word syn, that means syn means the union, and the osteo word is meaning the bone. Okay, osteo is for the bone. So on synostosis, what is happening, the suture completely loses its capacity of movement. Hence the skull fractures, they are very common in elderly. Okay, and it begins on the deeper aspect of the suture and gradually extends onto the superficial aspect. Okay, so that is something about the synostosis which you have to remember. Then we talk about the syndesmosis. Okay, next the term is syndesmosis. I hope you remember, we are still in the first category only. Okay, fibrous only, we are not moving to cartilage till now. Syndesmosis, in this the bones are connected with each other by a fibrous connective tissue, sheet or a ligament. So syndesmos, actually this word has been derived from the word syndesmos. Okay, this means ligament in Greek. This means ligament in Greek. Okay, so this permits slight degree of movements. Syndesmosis, there is slight degree of movement. Okay, and these membranes or ligaments, they persist throughout the life. Now what is important about this is the examples. So please remember, they are very commonly asked. Syndesmosis. So first example is interosseous radio-ulnar joint. See the word, I am breaking the word interosseous. That means osseous means bones. So between the two bones. Okay. So interosseous, the radio-ulnar joint. Radio-ulnar joint between the radius and ulna, and interosseous tibiofibular joint. Tibiofibular joint. Okay. And what else? The inferior tibiofibular joint. Okay. So let me just write it separately. Wait. The tibiofibular joint is very important. Don't forget. Okay. Tibiofibular joint. Now tibiofibular joint, if you see, let me just copy. See, now tibiofibular joint will come in two formats here. Okay. One was the joint which we have discussed, that is the interosseous radio-ulnar joint. Then again we have the interosseous tibiofibular joint. So interosseous means between the two bones. Okay. Let me show you, maybe you will understand better. See, if I just add the connective tissue. Okay. See, we are talking about this. This is the interosseous joint between the radius and ulna. Okay. Similarly, there is an interosseous joint between the tibia and fibula. Okay. So this is the interosseous. Then you have an inferior tibiofibular joint. So there is a joint between the tibia and the fibula inferiorly. Okay. That we will discuss eventually. I will have to remove everything now. Okay. So just remember, these are the two membranous structures which you have to recall. Okay. So interosseous. Now the other one is the inferior. We will talk about this in lower limb also in detail. Don't worry. Okay. Inferior tibiofibular joint. Then another one is the tympano-stapedial joint. Okay. Tympano-stapedial joint. Okay. So this is about the syndesmosis, and you can see the same in this photo also. It is showing the interosseous ligament of the inferior tibiofibular syndesmosis. So this point we already discussed the interosseous one. So there is inferior one which is between these two, tibia and fibula. Okay. There would be superior also. We will come to that eventually. Okay. Next we come on to the gomphosis. Okay. Gomphosis can also be called as peg and socket type of joint. Peg and socket. Gomphosis or peg and socket joint. Okay. Now what about this? In gomphosis, see, very easy again. Gomphosis, the word is gums. So remember tooth, something related to the tooth. Okay. So the joint here is very simple. That is the tooth in the alveolar socket which is fixed with the periodontal ligament. This is the key point to remember, periodontal ligament. Okay. This is asked. Okay. So gomphosis, a peg shaped process, is fixed into the socket by a fibrous connective tissue. You can see in this photo also. So this does not permit any movement. Teeth are not moving, right? So it does not permit movement. Okay. So example is, you can write the root of the tooth root of the tooth fixed to the alveolar socket of jaw. Alveolar socket of jaw, okay, by the structure that is periodontal ligament. Okay, all right. Then we move on to the next big category, that is the cartilaginous joints. Okay, cartilaginous joints. Okay, now in this category of cartilaginous joints, the articulating bones are connected by the hyaline or fibrocartilage. Okay, the bones connected by the hyaline or fibrocartilage. Okay, so these joints, cartilaginous joints, these are slightly movable joints. These are slightly movable. You remember the name of slightly movable joints? Though that other name was amphiarthrosis, right? And also they do not have joint cavity. Do not have joint cavity. Okay, do not have joint cavity. Then classification. I told you classification is of two types, primary and secondary. So let us move to this. So first category is primary cartilaginous joints. Okay, now primary cartilaginous joint, this is also known as, if you remember, the other name for this was synchondrosis. This is synchondrosis. Okay. In primary, the bones are connected by the plate of hyaline cartilage. Okay, so what are the features? They are connected by the hyaline cartilage. These are also known as temporary joints. Also known as temporary joints. Please remember these very important things. Okay, in the exams it is frequently asked. So at a certain age, the cartilaginous plate is replaced by the bone with ossification. Okay, and these joints are immovable joints. These are immovable. Okay, and they are designed for bone growth. They are designed for bone growth. Okay, so classical example, as you can see in this photo also, I am writing all the examples in green color so that you remember. Okay, different color. So joint between the epiphysis and diaphysis, that is one example. First example. Example number second, we have written that. Okay, yeah, 1, 2, 3 and 4 examples were here. Okay. So this is the first example. Second example, joint between the basi-occiput and the basi-sphenoid. Now don't worry about these terms because this will take another hour if I keep on adding all these 3D animations here. It's not required also. Don't panic and don't worry. All these nomenclature of these bones and everything will be covered region wise, extremity wise. Okay, so I would strongly suggest you to come back to this lecture again once you have done with head and neck, upper limb, all these major so that you can revise this again and again. And anyways you will keep on forgetting, so this is very important to revise. Okay, so first chondrosternal joint. First chondrosternal joint. So all these are classical examples of the primary cartilaginous joint. Next we move on to the category that is the secondary cartilaginous joint. I hope now it is making crystal clear sense in your head what we are dealing with and how these joint categories are being discussed. Okay, So that is the reason I primarily wrote all the types first. Otherwise, you know, in certain textbooks, in lectures, you will not understand. So secondary cartilaginous joint refers, the other name is symphysis. Now what is happening in this? Simple. In secondary cartilaginous joint, the articular surfaces of the bones, it is covered by hyaline cartilage and it is further connected by a pad of fibrocartilage. So you can see hyaline cartilage is there lining the surface of the bones, but there is a pad of fibrocartilage in between them. So this is secondary. Okay. Now classically, as you can remember, these are also known as permanent joints. Those were temporary, na? So these are permanent joints. Okay, these are permanent joints. Now they persist throughout the life, except there is an exception, that is symphysis menti. Okay, chin. Not very important, that's an extra point you may or may not remember. Other points are the articular surfaces are covered by hyaline cartilage and united by a pad of fibrocartilage. They typically occur in the midline. This will help you to remember the examples. They typically occur in the midline. Now only limited movements are permitted in these joints. Okay, limited movements. Now what are the examples? As you can see on the photo also, one example is pubic symphysis, that is number 1. Number 2, intervertebral disc between the bodies of the adjacent vertebra. So classically, if you remember, there are two parts of the intervertebral disc. The center part is the nucleus pulposus and the outside ring like structure, this is the annulus fibrosus. We will come to that eventually when we will discuss the region wise anatomy. But right now, just remember one example, two examples. These are the core important examples. Number 3 is manubriosternal joint. Manubriosternal joint. Number 4, that is the symphysis menti. Okay, symphysis menti. Okay, so between the two halves of the mandible, this is actually not a true symphysial joint. So you may or may not remember, but this is okay if you get the question. So all the symphysial joints, they belong to the axial skeleton, except the pubic symphysis, which belongs to the appendicular skeleton. That's a fun fact to remember. Okay. Next we come on to the clinical integration. Clinical integration. Okay. Okay. The growth of the long bone. Growth of long bone. Okay. So primary cartilaginous joint between the epiphysis and the diaphysis, if you see in this photo, this one, this is the bone, okay, long bone. So this is part is a shaft, that is the diaphysis, end is the epiphysis. Here you have the epiphyseal plate between them. Okay, there is metaphysis also, that will be covered eventually. So primary cartilaginous joint is the joint between the epiphysis and the diaphysis of a long bone, and that is actually the site of bone growth also. So at a certain age, this joint will ossify. Okay, so this epiphyseal plate is the actually also known as growth plate. Okay, so this is a important point to remember regarding the growth of the long bone. Okay, so then you can see this differences if you get a question as a short note to differentiate between the two. I have given you in the form of a table also, so that you can remember. Okay, so connected bones, don't forget type of cartilage, movement, and then location, and then common example. Okay, even duration we have discussed, temporary and permanent. So this is the same thing which we have discussed, I'm not repeating. Okay, next we move to the classification major one, that is the synovial joints, and this is the main huge big classification which has a lot of joints under this as examples. Okay, so first and foremost, synovial joint. In synovial joint, the articulating surfaces are covered by the hyaline cartilage only, and they are separated by the cavity. So that is important. Okay, bones are, there is a presence of joint cavity. joint cavity is present. So this is the classical important point to remember, and they are highly evolved joints and they are very movable joints, so they are mobile joints. Okay, therefore they are known as diarthrosis, you remember. So diarthrodial joints. This is another example important question which has been asked in the NEET exams. Diarthrodial joints. Okay, they use these words to confuse you. They will not label at synovial, they will ask you diarthrodial joint. Which of the following is an example of diarthrodial joint? So that way they will ask you. Okay, very simple questions, just need to know. So this image we have already discussed. Okay, the same image which we have discussed previously, it is same. So what are the characteristic features of the synovial joint? As you can see in this photo, the features. Okay, this comes as a question to be known, so that's why I'm spending some time on this. So features number 1, that is joint cavity. Okay, so the presence of joint cavity is a characteristic feature of the synovial joints. It lies between the articular surfaces and it is enclosed by the articular capsule. It is filled with the synovial fluid. Okay, so then you have the second feature, that is the articular surfaces. Okay, I'm writing the key points so that you can recollect later, but I am discussing. The smooth articular surfaces, they are covered with hyaline articular cartilage. The number 3, we have the synovial membrane. Synovial membrane and fluid. Okay, so internally it is lined by the synovial membrane which produces the synovial fluid. Okay, then number 4, we have the intra-articular disc or the meniscus. Intra-articular disc, or the word used is meniscus. Okay, so the fibrocartilage that divides the joint cavity incompletely or completely, or some joints. Okay, so classically then we have number 5, that is the ligaments. Okay, so these joints, synovial joints, are supported by capsular ligament and various other ligaments. Region wise we will discuss that. Then movements. So it permits various movements to certain extents. Okay, that also we will discuss eventually. Next we come on to the classification of the synovial joints. So we have already discussed the classification, if you remember, that 7 categories now, but I am going to tell you the classification in another format. Okay, so please write. It is the same thing which we have discussed but in another format. Classification of synovial joints. And this category which I am writing, which will make your life very easy, it is given in very less textbooks, okay, of anatomy. So number first category, that is the plane or gliding joints. Plane or gliding joints. Number 2 category is uniaxial joints. So new term for you, uniaxial joints. Now in the uniaxial joints we have 2, that is the hinge joint and the pivot joint. Okay, if I use the same color you will be able to recollect the plane or the gliding. So these blue terms we have already discussed previously. Okay, I have taken the names, I am writing the new ones in black color here. Then you have biaxial joints. Biaxial joints. Uni means one, I hope you know, one axis movement is there. Bi means 2 axis, I hope this is clear. Okay, so biaxial joints, it consists of condylar joints. It consists of condylar joints and what else? Ellipsoid joints. Okay, so we have done 1 2 3 4 5. Okay, next we move on to the 4th, that is bi means 2, so we have last category, that is the multi axial joints. So out of those 7 we have already written 5, so the other 2 are left, that is the saddle joint and the ball and socket joint. Okay, so this is the classification which you have to remember in another format, and this will help you to remember the axis. Okay, so number 1, let us discuss the first one, that is the plane joint. Okay, so number 1 that is a plane joint. Okay, now plane joint, plane or gliding joints. So in plane or plane synovial joints, the articular surfaces are plane or I can say flat. Okay, so we have already seen the photos previously also, but I am going to tell you now. So the articular surface are plane, articular surfaces are plane or I can say flat. Okay, so movements, talking about movements, they permit gliding movements, they permit the gliding movements. So again same problem, we have to remember the name of the joint and its examples. Okay, what are the examples? Intercarpal joints, between the various carpal bones, intercarpal, intertarsal, okay, foot bones, then intermetacarpals, intermetacarpal and intermetatarsal, intermetatarsal. Then joints between the articular processes articular processes of adjacent vertebrae, articular processes of adjacent vertebrae. And this again we will discuss when we will discuss the vertebrae, what are the articular processes and all, we will discuss everything in detail. Next we move on to the second category, that is the hinge joint. Hinge joint also has another name, ginglymi. Okay, it is GINGLYMI. Okay, in certain textbooks you will find all these terminologies, ginglymi. Okay, so what are the features? Articular surfaces are very important. Articular surfaces are pulley shaped. Can you see in the photo? They are pulley shaped. Okay, like a pulley. You can see this photograph. The movement is happening in this manner. This is pulley shaped. Okay. So these are the uniaxial joint category only. We already discussed uniaxial joints. So one axis movement will be there. Only these joints will permit the movements in one plane around a transverse axis. Okay. So classical examples include the elbow joint. Okay, elbow joint, then ankle joint, elbow joint, ankle joint, interphalangeal joints. Interphalangeal joints. Okay, then we move on to the third category, that is the pivot joint. The pivot, also known as trochoid joint. Trochoid joint. Okay. Now articular surface of one bone is pivot or I can say peg shaped, which is surrounded by the osteocartilaginous ring. Can you see in this photo? This seems to be the atlas and axis articulation. So you can see a pivot is formed around which a ring is formed. Okay, it is moving in this manner. Okay, so this is the osteocartilaginous ring which is formed. Okay, so you can say, and we will discuss about this transverse ligament and everything, about the median atlantoaxial joint, which you can see here, it is written median atlantoaxial joint. This is very important. Okay, this is atlas and axis is the first and second cervical vertebra, if you remember. Okay, so pivot or trichot joint, this has the articular surface of one bone, articular surface of one bone is pivot or peg. Okay, articular surface of one bone is pivot or peg shaped. Okay, which is surrounded by this is surrounded by the osteocartilaginous ring. That is very important. The osteocartilaginous ring. Okay, so movement, talking about the movement, if you remember, the movement would be uniaxial only. Okay, it's a uniaxial variety only. That solves your problem, that which joint is having one axis movement or two axis movement, that is also clear. So it would permit limited rotation movements. This movement, no movement. Okay, no movement means no movement नहीं, मतलब कि no वाली movement. Okay, so it permits limited rotation movement along the vertical axis. ठीक है, so classical examples, let us write. Example, atlantoaxial joint, as you can see in this photo also, atlantoaxial joint, that is the dens or the odontoid process. This of axis vertebra is the pivot that is surrounded by the ring of arch of atlas and the transverse ligament of the atlas. Okay, then superior radio-ulnar joint, superior radio-ulnar joint. Okay, the head of the radius is the pivot that rotates within the ring formed by the annular ligament and the radial notch of the ulna. Okay, so that is the radio-ulnar, superior radio-ulnar articulation, which we will discuss separately when we will discuss the upper limb, so don't worry on that. Okay, then we talk about the fourth category, that is condylar joints. Okay, condylar joints. Now in this condylar joint, the articular surfaces are condylar. That means one is convex and the other is concave. So see, convex and concave. So that is the condylar joint. Okay, so please remember, one surface is convex and other is concave. Okay, movement, if you remember, it is a biaxial joint. It's a biaxial, so two axes, along the two axes, so it permits the movement in two directions, up and down and side to side. Okay, so just see the classical example which is shown here is a temporomandibular joint, TMJ. Okay, so classical example, this is up and down and side to side. So there are two axes involved, so don't go into further details too much. I'm just telling you, just remember this. And classical examples are, number one, the TMJ, that is the temporomandibular joint. This is a very important joint of the body, and we will discuss very much in detail when we will discuss the head and neck. And this is a very favorite question, the movements of TMJ by the muscles of mastication. Very famous question for the INI AIMS examinations. Nowadays they keep on asking repeatedly, like since the last, I can say 10 or 12 years, I am seeing every year, every exam has, from AIMS and NEET, has the MCQ based on this topic, TMJ. Okay, So you can remember. Another important topic of lower limb is the knee joint. Knee joint super duper important for our exams. Long question, 10 marks, 12 marks question, 15 marks question. Definitely a professional exam, university exam question, knee joint, which we will discuss in the lower limb. Okay. Number 4 category we have seen. So now see, this is the categorization for the condylar. So this kind of picture is for the TMJ joint, where you have an intra-articular disc in between the joint. Okay, this is the head of the mandible, this is the articular eminence and articular fossa, which we will discuss eventually. Then number 5, I guess, yes, number 5. Number 5 is the ellipsoid joint. Now in ellipsoid joint, what is the difference? The articular surface are elliptical. Surfaces are elliptical. Okay, and one of them is convex, one is convex, and the second one is concave. Okay, you can see convex and concave. So this elliptical, so it is also a biaxial joint, that we know. Okay, biaxial joint. So it permits movements again in two axes. One is flexion. See, the classical example which you can see here is the let me highlight this, metacarpophalangeal joint, which you can appreciate in this photo. Okay, metacarpophalangeal joint. So see, the flexion and metacarpophalangeal joints between the metacarpal, so these are the metacarpal bones here, okay, and this is the phalanx. Okay, so there will be a flexion extension around the transverse axis, and there will be adduction abduction around the anteroposterior axis. Okay, so a combination of these movements is the circumduction. Okay, circumduction. So this is happening between the joint, that is between the metacarpal bone and the phalanges. Okay, so that is the classical example, very easy to remember. So let me write this classical example. The first one in the list is radiocarpal or the wrist joint. Radiocarpal or the wrist joint. We will take up this joint separately in upper limb in detail, don't worry. Then metacarpophalangeal joint, that is the MCP joint. Then metatarsophalangeal joint in the foot. Okay, that MCP joint was in the upper limb. Okay, then we have atlanto-occipital joint, very important, and this is one example which you can never ever forget because most commonly it is asked. See, if you recall, there was a joint, see, the occiput, that is the skull, is sitting on the which bone? That is the atlas. Then atlas is articulating with the axis, the first cervical, second cervical. So between the first and second cervical you had a movement, this one no movement, that was the pivot joint, if you remember. The next important joint is between the occiput, the occipital condyle, which will set onto the atlas. So atlanto-occipital joint, this is an ellipsoid joint, it is not a condylar joint. Please remember, always you will have a confusion because occipital condyles are articulating with the atlas. So this is not a condylar joint, this is an ellipsoid joint because of the shape which we have discussed. Okay, so very important example, most commonly asked in the viva also and MCQs also. Okay, we have discussed the others. So 5 is done. Then 6. The sixth category is saddle, or also known as sellar joints, sellar joint. Okay. So in saddle joints, what is happening? The articular surfaces, they are reciprocally saddle shaped. So that is, I can say, concavo-convex. Okay. So they are reciprocally concavo-convex. Okay, so they are reciprocally saddle shaped, that is concavo-convex. Okay, saddle shaped, just like a horse saddle, if you remember. Okay, so this was falling into the category of multi-axial, if you remember, we have put it in the starting list. It is a multi-axial joint. So it permits free movements in two axes and some movement in the third axis also as a extra action, conjunct action, rotation. So there will be flexion, extension, adduction, abduction along with some rotatory component. Okay, so that is the saddle joint. Now classical example, first carpo-metacarpal joint, first carpo metacarpal joint. Okay, the sternoclavicular joint, sternoclavicular joint, and then incudo, please remember, incudo malleolar joint between the incus and the malleus. So remember the three ear ossicles, malleus, incus and stapes. So between the incus and malleus is the joint category is a saddle. Okay, then you have another example, that is the calcaneocuboid joint. Okay, calcaneocuboid joint. These are the foot bones, calcaneocuboid, we will discuss that. Okay, then number 7. I've given you the images also so that you can, remember and revise later. Number 7, that is the ball and socket joint, which is the most easy one. Ball and socket joint. It is also known as spheroidal joints. Spheroidal joint. Okay, so in ball and socket joint, the globular or rounded convex surface of one bone fits into the cup shaped socket of another bone. Okay, so just see how this is fitting into this ball, fitting into a socket. Simple, a ball is fitting into a socket. Okay, so this is a very important and a common thing, that is the ball and socket joint, which is movement is multi-axial. If you remember, it is a multi-axial variety only. Okay, multi-axial joint. It permits the movements in around an indefinite multiple number of axes. So it can perform flexion, extension, adduction, abduction, medial, lateral rotation, circumduction. So any examples which are coming to your mind of such freely movable joints? Shoulder joint, yes, shoulder joint, very important joint in the body, shoulder joint. Hip joint, then talocalcaneonavicular joint. Okay, you can write an abbreviation TCN. Okay, TCN. This is very important, famous examples. So see, to be very honest, you always remember the shoulder joint and hip joint, but you never remember the last two examples. So that is incudostapedial joint. Okay, so there are actually only 4 ball and socket joints in the entire human body. So you got to remember these two examples apart from the hip joint and shoulder joint, because these are oftenly asked in the exams and most commonly framed MCQs. Okay, these are very important examples. So what I told you is, if you see previous image, between the malleus, incus and stapes, you have incus and malleus. Okay, incus and malleus. So between these two you have the saddle variety. Okay, and if you talk about the malleus, incus and stapes, between the incus and stapes you have the ball and socket variety. Okay, so don't forget the malleus, incus and stapes. Okay, next we come on to the components of synovial joints. Okay, components of synovial joints. Now, what are the components of synovial joints? Classically, the synovial joint consists of the articular cartilage, articular cartilage. Number 2, the articular capsule. Number 3, synovial fluid. Number 4, the synovial membrane. Number 5, the ligaments, various ligaments. This will vary from joints to joints. Number 6, articular disc. And number 7, the bursae. Okay, so these are the components of the synovial joints. Okay, so this all things which we'll be discussing in detail, joint to joint it will vary. So we will discuss everything in quite detail later on. Okay, so don't worry about each of these points, because anyways this will be coming again and again. Okay, then we come on to the next thing, that is the, after the components of the synovial joints, you should be knowing that there are some things which are known as the classification based on the number of bones. Okay, so I can write that. You can see this point here, the categorization into 3 points. This is a different categorization, not on the previous lines. Okay, simple, compound joint. Okay, and C is complex joint. Okay, so these 3 we have. So number 1, first and foremost, simple joint. In these joints, only 2 bones are taking part in the formation of a joint. Okay, only 2 bones. This is classification of joints. Now we have done the synovial. Okay, we have done fibrous, cartilaginous, synovial. We have done classification of joints based on the number of bones. Okay, so here we have only 2 bones. Okay, we have only 2 bones, and then that is the interphalangeal joints of fingers, of toes. Okay, so you can see in this PIP means proximal, DIP means distal interphalangeal joints. Okay, so this will be the DIP, this will be the PIP. Okay, so then you have the compound joint, which has more than 2 bones are participating. More than 2 bones are involved in the formation of the joint. Okay, so classical example of this again is ankle joint, elbow joint, radiocarpal joint, that is wrist joint. Okay, so you can write these examples here. First one we have already discussed, interphalangeal. For this you have other examples also, important ones. Wrist joint we have written. Wrist joint is radiocarpal joint. Okay, this is radiocarpal joint or wrist joint. So articulating bones in this radiocarpal joint are radius, as you can see in this photo, radius, scaphoid. Okay, very important, scaphoid, lunate bone, and triquetral. Okay, not the ulna, please remember, that is important. Okay, so this all will be coming and we will be discussing eventually. So it is radiocarpal, it's not ulnocarpal or radioulnar, that is a separate joint. Okay, we have discussed that. So please remember, that is number 1 category, wrist joint. Second example of this is ankle joint. Ankle joint, classical example, tibia, fibula, talus. Number 3, you have the elbow joint. Elbow joint, classical example, don't worry if I'm writing behind my back. Okay, because anyway you will be getting this PDF, I don't want to waste this space. So elbow joint is humerus, radius and ulna. Okay, we will read these joints in detail region wise, so don't panic. Okay, so this is more than two bones. Then we have number 3, that is a complex. Now in this joint there is only one difference, that is the intra-articular disc is present. Okay, we have an intra-articular disc which is dividing the joint cavity. It divides the joint cavity into two compartments. It divides the joint cavity into two compartments. So classical example of this is the TMJ. We have already seen this photo. Okay, TMJ. The knee joint, we will discuss all the menisci and everything. Another joint is sternoclavicular joint. Okay, and you have acromioclavicular joint. Okay, so we'll discuss that eventually, don't worry. Then we come on to the clinical integration. Now very important point, clinical integration. By now we know many things about the joints as such. Okay. Okay, so the first condition here we have, that is osteoarthritis. Now osteoarthritis is a degenerative condition of the articular cartilage. It involves the weight bearing joints. Okay, it involves the wear out and degenerative changes in the articular cartilage, and due to these changes the articular bones, they start rubbing together and they cause a lot of pain during these movements. Okay, then you have number 2, that is the osteophytes. All these words will come to you in the picture when you will discuss the orthopedics in the final year. Okay. Osteophytes, sometimes in old age what happens, the articular cartilage, it overgrows and later it gets ossified to form the osteophytes, and this is also known as pseudobone. Okay, number 3 category, we have the rheumatoid arthritis. Please check the spellings which I am writing, because you don't remember the spellings, you remember the terms, you remember the explanations also sometimes, but you miss to write the correct spellings in the exam. So please check what I am writing when you are copying or making your own notes. So rheumatoid arthritis is a chronic progressive inflammatory autoimmune disease which involves the synovial membrane, and this leads to thickening of the synovial membrane, and in later stages it causes degeneration of the articular cartilage. This commonly affects the small joints of the hand and the feet. Number 4 term, that is the arthroplasty. Now this is a surgical repair, or I can say replacement of a joint. Okay, then classically we have the difference between the osteoarthritis and the rheumatoid arthritis. Okay, you can read about this at your level, because the main thing is regarding the joints. Okay, small joints and large weight joints involvement, this, and plus another thing, this is due to the wear and tear with aging, this is an autoimmune disease. So these are few differences between the two major things. Okay, rheumatoid arthritis and the osteoarthritis. Okay. Okay, synovial membrane, I'm so sorry, this is written again, this should be synovial membrane. Okay. Right. Then we come on to the difference after we have discussed this, then we come on to the movements of the synovial joints. The movements of the synovial joints. Okay. Now movements can be classified into two categories. One is the active movement and one is the passive movement. Active movement is produced when the individual uses his or her own muscles and strength. Passive when produced when the external force acts at the joint. It can include gravity or force by the examining doctor. So active movements can be further classified into categories, if you know, the gliding or the slipping movements, the gliding movements, okay, the angular movements. Angular movements involve flexion, extension, adduction, abduction. Okay, this involves flexion, extension, abduction and adduction. We have discussed that previously. Then rotatory or circular movements, rotatory or I can say circular movements. Okay. Then circumduction, that is the combination of all these movements. Okay. Special movements which are the special movements which includes the inversion. You remember the inversion of foot, eversion of foot. Okay. Protraction, retraction movements, okay, of the scapula, of the jaw. Okay. Then elevation, depression, again scapula also and the jaw, that is a mandible. Okay. All these are movements, possible active movements, okay, which you should be knowing. And then if we talk, see, movements we have already discussed in the first class of general anatomy, where we have discussed the terminologies, if you remember, right? Then we talk about the something extra, that is the Hilton's law as per the NMC competency which was given, if you remember, the Hilton's law. Okay. Now Hilton's law states that the nerves which are supplying the joint, they also supply the muscle that act on that joint. So the nerve, please understand and write this clearly because it is as per competency. The nerves supplying the joint, they also supply the muscles that act on that joint. Okay. And also the skin, covering the joint. Okay. So now see, clinical significance, see, you can see in this image the nerve supplying the joint okay, which are forming here, which is shown in this image, they are also supplying the muscles. Okay, the joint supplying the nerves which are supplying the joint, they are also supplying the muscles and also the skin over the area. Okay, so it is very simple. So what is the clinical significance of this? The irritation of these nerves supplying the joint due to certain trauma or any other disease, it can cause reflex spasm of the muscles. So this fixes the joint in a position of greater comfort, and the pain of the joint is referred to the skin covering the joint. So that becomes very clinically relevant, Hilton's law. Okay. Then we talk about, the factors which are important for maintaining the stability of the joint. factors maintaining the stability of joint. Okay, what are these? Number one, that is the shape of the bones, which provides stability to the joints, especially in the hip joint, the head of the femur, it fits in the socket of the hip bone, and in the ankle joint, the malleoli of the tibia and fibula, they hold the talus in position. Okay. Number two, the ligaments, very important. Ligaments, they prevent the excessive movements of the joint. Number three, we have the muscles, okay, and also the tendons. Okay, so the tone of the different groups of muscles acting at the joint is very important and indispensable factor in maintaining the stability of the joint. So what will be the clinical integration of this point? If we got to discuss the clinical integration, this is number one, dislocation of the joint. So supposedly stability is hampered, so the condition in which the bones forming the joint are forced out of their normal position, it causes separation of the joint surfaces. What are the causes of this joint dislocation? This can be due to, it can be due to trauma, okay, muscle weakness. Why I am telling you all this? Because viva is very important. In MBBS you will experience viva, they will ask you everything, but I am teaching you. So you have to explore your mind, you know, it is very wide. If you have listened it once, that will help you in the exam. Muscle weakness, muscle paralysis, or overstretching of joints. Okay, then we talk about the position of the joint. Now see, there are two terminologies used: close packed position and loose packed position. Okay, close packed and loose packed position. Now in this category you have, one is the close packed. So in this position the joint surfaces, they become completely congruent, their area of contract is maximal and they are very tightly compressed, as you can see, close packed position. Okay, in this position the joint capsule, supporting ligaments, they all are very taut. Okay, they are stretched, hence no further movements are possible and the surfaces cannot be pulled apart. In this position the articular surfaces, they become prone to trauma. So that is one thing which you have to remember. Okay, if you talk about the loose packed position, in this position the articular surfaces are incongruent, so joint space is freely mobile. The joints are prone to dislocation into the position. So please remember these two clinical aspects. Close packed position is more the articular surfaces are more prone to trauma. Articular prone to trauma. Loose packed causes its prone to dislocation. The bones are, the joint can be dislocated in this position, loose packed position. Okay, so this is an example. So this is a flow chart which you can remember the same things which we have discussed. So for each of these joints, elbow, shoulder, hip, knee, ankle, so you can see what will be the position which will be close packed and loose packed. Okay, so that is a concept which you can remember. Other than that, so I hope I have done justice to your time and you have understood something about the joints. Thank you.